the mask mandate does not mean the risk is gone. COVID-19 transmission is still occurring across the province, and masks can help protect you and others from becoming infected with COVID-19. In fact, we can expect indicators such as cases and hospitalizations to increase slightly as Ontario increasingly interacts with one another. However, thanks to our high vaccination rates and natural immunity that is developing, as well as the arrival of other therapeutics and antivirals, Ontario has the tools necessary to manage the impacts of this virus.
Those protective pandemic staples like mask wearing or symptom screening requirements in most situations will end in less than 2 weeks. So let's start with the now. Effective immediately, those exposed to COVID-19 by someone outside of their household doesn't need to self-isolate, even if you're unvaccinated. Now, those exposed to COVID-19 by members inside your household or their household don't need to self-isolate if they're over 18 years of age and boosted, under 18 years old and fully vaccinated, or if you've recovered from a COVID-19 infection in the past 90 days. This specific self-isolation guidance will continue until further notice. Also continuing until further notice, if you test positive yourself and are fully vaccinated or are under the age of 12, you still have to self-isolate for 5 days. Now, masks as of March the 21st. Ontarians are no longer required to wear masks in most indoor public settings and schools. Also gone on March the 21st will be the daily symptom screening requirement parents must complete before dropping their children off at school. Users of public transit and all patients, residents, visitors, and staff in hospitals, congregate care settings, jails, and long-term care homes in the system will continue to be required to wear masks after March the 21st, but only until April the 27th. So on April the 27th, that is it. On that date, all remaining pandemic measures, directives, and orders end, with the exception of those self-isolation rules, as I mentioned. A lot to take in here. Dr. Moore, the province's Chief Medical Officer of Health, adds that removing the mask mandate does not mean the risk is gone, as he said, and he asks that people who choose to continue wearing masks be treated with respect. He was clear. Mask wearing will be a choice after April the 27th. So we know this announcement is filled with feelings of excitement or fraught with anxiety. So let's get some reaction. With their take, we're joined by Dr. Allan Grill, Chief of Family Medicine at Markham-Stouffville Hospital, Dr. Brooks Fallis, Peel Region Critical Care Physician, I should say, and Dr. Barry Pakes, York Region's Medical Officer of Health. Thank you all for being here. Dr. Grill, I'm going to start with you. Is this timeline sufficient?
Thanks so much for having me this evening. I would say that I think we're dropping the mask mandate a little bit too early. I mean, you know, Ontario's done really well, especially in the last 2 months when we had this Omicron wave, to get the numbers down, you know, and that was a combination of capacity, restrictions, masking, you know, trying to increase vaccinations. And we've actually gotten to a point where the number of patients that are hospitalized have gone down, and the stress on our healthcare capacity has also, you know, been buffered a little bit. Even outbreaks in long-term care and schools are less now than they were a couple months ago. But we just lifted the capacity restrictions a week ago, and I just don't see why we're in such a hurry to drop mask mandates. I mean, we know masking reduces transmission. It does protect people. Our hospitals are still busy, even though it's not all COVID. You know, our emergency rooms are still seeing lots of sick patients. We don't want more COVID patients coming in. And I would have liked a little bit more time to see what's going to happen, knowing that the restrictions are gone. The other thing is, I feel for our students. I mean, Ontario students have missed more school than most other provinces in Canada. They're used to wearing masks. I don't see why lifting them now is so necessary. Like, maybe wait a little bit longer till the weather gets better and people start congregating more outdoors. And finally, you know, kids under 5, we still can't vaccinate them. And there's still immunocompromised people. I've got patients in those situations as well. So I would have liked the mask mandate to continue a little bit longer until we were more confident that case counts and hospitalizations are down.
On that note, Dr. Grill, Dr. Moore has said for those who are immunocompromised or in a dealing with a vulnerable state or more vulnerable to COVID-19, they should continue to wear the masks. But it's clear that it is a choice. So, Dr. Fallis, I want to come to you now here. I have read some of your concerns about this that you have posted online, but we have heard from students and their frustrations with wearing the masks in the classroom. But of course, we've also heard from many, as well as educators, who want them to stay on. But it is clear that it is a choice. And school boards can continue to say, look, you come into our school, you need to wear a mask. So why is this not a balanced approach?
Well, I think that what we have to realize is that masks have been an extremely, extremely effective technique for reducing transmission in a number of different settings, particularly settings where people need to be indoors together, like schools, like hospitals, like long-term care, and like even shops and grocery stores. So, it's hard to know exactly how impactful those measures have been, but we do know from many studies that the impact is significant. But we also know that the importance of masking is bidirectional. So both the person, if one person's infected and another person's not, you don't equally protect yourself by just the one person wearing the mask. You get enhanced protection by both people wearing the mask. We also know that it's additive on top of vaccination. So this is a very significant layer of protection that we've been relying on for a long time. And when we look at what's happening right now, we can see that in the wastewater data for Ontario, we are clearly hitting a plateau. The hospitalizations are not really dropping very quickly anymore, and ICU admissions are also sort of hitting a plateau of around 10 to 15 admissions per day. So if we remove a very significant safety net right now, we will expect that things will increase. And I agree completely with Dr. Grill that the timing of this is not sensible. People are going to be coming back from March break. It's still very cold outside, so people are spending a lot of extra time indoors. It would be much more sensible to wait a couple of weeks after March break, see how things play out in schools, see how things play out in terms of hospitalizations, and then make a decision rather than rushing into removing what has been a very reliable and significant protection population-wide.
So, Dr. Fallis, what you're saying, what Dr. Grill is saying is quite consistent with what we've heard from everyone in the medical profession that we've been speaking with, including, of course, those who work at Sick Kids Hospital or McMaster Children's Center. They had asked the province to hold off on removing the mask mandate until a period after the March break. So I want to bring in Dr. Barry Pakes, York Region's Medical Officer of Health. So Dr. Moore, and we ran this clip, I want to repeat it. He says, thanks to our high vaccination rates and natural immunity that is developing, as well as the arrival of other therapeutics and antivirals, Ontario has the tools necessary to manage the impacts of this virus. He also said we've passed the peak of Omicron. So, Dr. Pakes, I hear what your peers here are saying, but I mean, how much longer should we have held on to masks if that's what we're hearing from the medical community?
So I certainly do agree with my colleagues that it's going to be a challenging time. I think Dr. Moore did acknowledge that. He acknowledged that it's likely that there's going to be increased transmission and potentially increased hospitalizations as a result. And from that perspective, he was attempting to balance the many people who are enthusiastic about getting rid of masks and the many people who are enthusiastic about keeping them on or fearful. But there are various opinions about when that should actually be, and it would have been reasonable to wait a little bit longer, certainly.
Dr. Pakes, as York Region's Medical Officer of Health, do you not have the ability under a Section 22 to say in York Region, we are going to continue to impose the wearing of masks in indoor settings like stores and schools? Is that something you could move forward with?
So it's certainly something that we could do, and certainly the group of medical officers of health, that's the sort of things that we've talked about and thought about. I don't think that it's going to be appropriate or, that it's something we're going to be able to do for a variety of reasons. I think what we are going to do, and I've already said a number of times, that we are going to strongly encourage people to continue to wear masks, even if you're not going to wear the mask all the time. Just keep it in your pocket, and everyone can make the decision for themselves, not only about wearing masks, but have it in your pocket and wear it when you are in a store with a lot of people. If if you're getting into an elevator, and if you notice someone who's, obviously concerned about your not wearing a mask or mask wearing in general. I think a big piece of this is going to be kindness and consideration for other people. It's going to be an adjustment for people. And I think for the next 2 weeks following March break, certainly, I would encourage everyone to wear a mask or at least keep one in your pocket.
And, Dr. Moore's comment about how this is about choice. Dr. Grill, I'll put this to you. We have seen throughout the pandemic, frankly, compliance. You go into a big box store and you're not seeing all these people walking around maskless. For the most part, people are wearing masks because that's what, well, frankly, they've been instructed to do, but that is the provincial mandate. Do you think there will be, this feeling that people will feel okay to wear it if they want to? They won't feel intimidated by those who aren't? Do you think this will evolve quite smoothly?
I mean, I really hope so. I think one of the things that I'm proud about being Canadian is that, we tend to focus on our community and sort of like trying to support each other. And I think we've seen many examples of that through the pandemic. Well, whether it's, helping out a neighbor with something they need. If they're on social isolation, you bring them groceries, or trying to get, help someone book a vaccine. I mean, I think, I have a lot of pride to say in a lot of the community outreach we've done during this pandemic, how we've come together. I would really hope that anybody that wants to continue wearing a mask, and as Dr. Pakes said, I'm going to be encouraging some of my patients to continue to wear them, especially the ones that I feel have a higher individual risk assessment than others. I'd really hope that we're all really understanding as we move through this transition period, and we're respectful about wearing a mask. If I'm in a place and somebody, reached out and said, can you please wear a mask? There's somebody here that's immunocompromised. Of course, I'm going to put one on. And for my own comfort level, I'm probably going to continue to wear a mask in public for the next little while because I don't want to get sick. I don't want to bring it home to my family. So everybody's going to find their comfort level here. And I'm going to encourage my peers and my patients to really be respectful of those choices, especially considering there's still uncertainty with this pandemic. And the last thing we want to do as a community is sort of fight each other on this. We want to come together, support each other, and continue to work through this pandemic. I'm
going to try and fit in two quick questions with the time we have. I'm going to start with you, Dr. Fallis, and then quickly get to you, Dr. Pakes. Dr. Fallis, sorry, here. You work in Peel Region. This had been at points throughout the pandemic, particularly in Brampton, a hotbed of COVID-19. Do you anticipate some settings there, including hospitals, congregate care settings, long-term care homes, will say, after April the 27th, we're going to say, we're a private facility, let's say a long-term care home, you have to wear a mask if you're coming in?
Oh, absolutely. I expect that. I think and I hope the majority of hospitals will stick with a mask mandate. This and same thing for long-term care homes. I mean, these are locations where, extremely vulnerable people live or work or are seeking care, and it's our duty to protect them. And we know that universal masking works. I think that the problem with switching off of the universal plan is that it gives people individual choice, and it doesn't acknowledge the fact that if we all wear masks, we increase protection dramatically for everybody.
Okay, and I'm going to, final question for Dr. Pakes, the medical officer of health here on the panel. If the CMOH, Dr. Moore, had said, look, his decision is based on data, it's not political, but at the same time, the science table had said, hold on, this is a bit too soon. We would have preferred a bit of a waiting period here. Why do you think Dr. Moore has this date, March 21st, right after the March break, if he's saying it's based on data, not political?
I mean, that's a good question, and I think you'd have to ask Dr. Moore that. I think he's confident with the way things are going that it's a safe move. The data is difficult to interpret now. As you know, we're not really tracking cases anymore, but that is something you're going to have to ask Dr. Moore. I do know Dr. Moore, and he's a person of great integrity, so I certainly believe him when he says that it's not political.
And he had commented on that earlier today, saying really just that. Doctors, thank you so much for your time. We wish you all the best in this period of transition over the next few weeks. Thanks so much.